Welcome everybody to today's live stream Lunch and Learn session. Today we're going to talk about heart disease and the work of Dr. Caldwell Esselstyn and get into some of the details of the amazing work that he's done. Today's recipe from Alex at the Shine Cafe and Juice Bar in Orillia is chickpea and rainbow pepper tabbouleh salad. Here's a tip from Alex about preparing that for you guys.
Good morning, this is Alex again from Shine Plant-Based Kitchen with our helpful tip of the week for this week's Lunch and Learn. This week's Lunch and Learn is a rainbow pepper chickpea tabbouleh salad. Featured here, I'm going to show you a couple helpful tips about different ways to cut a pepper. There's several ways to do it. The first one is the easiest. Cut it in half. And once again, don't be afraid to use your hands. Take the inside and pop that out. And that's an easy way to clean them out. And a quick little slice. Okay, that's one way to do it. Another method is to go around the outside. Okay, and also another little fancy way to do it is just right from the back end. And then you get these nice little rings and cool shapes that you can put right on top as a garnish. Put a nice little bit of greens here. And Laura, let's zoom on in here, and this is what we're aiming for at the end of the day. Enjoy your Lunch and Learn.
Go.
Hello. So today's discussion is going to be centered around cardiovascular disease and how plant-based nutrition has a tremendous effect in conjunction with optimal medical therapy, or the right meds, to reduce people's rate of developing future heart problems, especially in the high-risk population, but also in patients who are at risk for cardiac disease. And if you look at the big scheme of things, anybody with high blood pressure, anybody with diabetes, anybody who's overweight, anybody with high cholesterol are at increased risk for heart disease. And basically, the more I learn about nutrition, as I've mentioned to you guys before, if you eat a North American diet, you're at increased risk for heart disease, especially when we look at population studies. So as a fellowship-trained cardiologist, which camera should I look at, by the way?
Either.
Okay. As a fellowship-trained cardiologist, and as I learned about plant-based nutrition, it was the work around cardiac disease that really caught my attention, despite the fact that Colin Campbell in his work looked at cardiac disease, but also his main area of interest in looking at incidences of disease in population was looking at cancer, particularly in this work around the China study. But it was Dr. Campbell's publication that made me aware of Dr. Caldwell Esselstyn's work, which was happening at the Cleveland Clinic, which Esselstyn later wrote in a bestseller book called Prevent and Reverse Heart Disease. So it was through Dr. Campbell's work that I found out about Dr. Esselstyn. In training, we'd heard about Dr. Dean Ornish, who I think at UCLA, somewhere in California, was doing work again in small numbers of patients, changing people from an animal-based to a plant-based diet with low fat, and showed that angiograms opened up, and just as important, that event rates went down and symptoms significantly improved. And that's going to be a key message that I'll keep coming back to, is that a lot of people say, well, what about controlling symptoms? Because a lot of people who have had bypass surgery, have had stenting, and get recurrent symptoms of angina, which can be severely limiting. So, we often hear about someone's got angina, but until it happens to you or happens to a loved one, symptoms limited by angina can be very, very severe. Some people have severe chest pain, 4 or 5 out of 10 chest pain, just tying up their shoes. So if you're limited with severe angina, that disabled, you can kiss goodbye actually going to the grocery store, carrying groceries, having intimate relations with your partner, running around the front lawn with your kids. Those things are just not going to happen because you're severely limited. So the good news is that stents and bypass surgery in the short term yes, can improve angina, but the improvement does not seem to be sustained for the majority of people. And yet with plant-based nutrition, you can definitely improve symptoms in a fairly short order, that as long as you stick to a healthy diet, that improvement can be sustained. But we'll come back to that a little bit later. So Dr. Esselstyn, I later got to know Dr. Esselstyn, and he's a wonderful person. Here's a picture of myself and Esselstyn at a conference in the Bronx. I think it was early December, and this slide will be available to you to see. In Dr. Campbell's follow-up book to the China study, he summarizes his colleague's work, Dr. Esselstyn, in the book Whole, W-H-O-L-E. And I just want to read part of that for you, just to give you some basis of where we're starting from. So in 1985, Dr. Caldwell Esselstyn recruited patients with advanced but not immediately life-threatening heart disease for a clinical trial to explore whether heart disease might be reversed using diet. He confirmed the severity of the coronary artery disease with angiograms to be sure that their disease progression was advanced. The only other requirement for admission into the study was a willingness to attempt the dietary changes he proposed, which was effectively a whole food plant-based diet. Dr. Esselstyn formally reported his findings at 5 years and at 12 years after the study began. And in the 8 years prior to the study, his 18 subjects had 49 coronary episodes. Now in cardiology, we mean an episode means either you show up with a heart attack, you show up requiring an angioplasty, or you show up requiring bypass surgery. So they had 49 coronary episodes in the 8 years prior to the study beginning. But during the 12 years after adopting the whole food plant-based diet, there was one event involving a patient who strayed from his diet. And that was a patient who, like a lot of us, when you get out of the shadow of death, you sort of loosen up on your habits sometimes. I think this man was a number of years totally stable, plant-based diet, got a bit sloppy with the diet, got recurrent chest pain, and then a number of weeks later, after switching his diet back to a healthy diet again, the chest pain went away. So I don't know if you'd call that an event as much as a misadventure. And he's casually, as in Dr. Esselstyn, followed his subjects since then, and all but 5 are still alive today, 26 years later. And this was written in around 2012. So the 5 who did pass away did not die of cardiac failure, but from other causes. And keep in mind, the average age of his subjects in 1985, when his study started, was 56. So if you're 56 in 1985, you'd be 83 by the time this was written in 2012. So that's really not unexpected. And the ones who are still alive, which is the majority, are cardiac symptom free, which is amazing because the majority of those patients were told, or a lot of them were told, you know, you should go home and get in your rocking chair and say your goodbyes because you got less than a year to live. And this was nearly a quarter century later that these people basically were saved. So the subjects had 49 events in the 96 months prior to the change in nutrition and effectively 0 events in the 300 months since the intervention began. And then Dr. Campbell says, and he's not one for exaggeration, I totally agree, he says, this life and death finding is about as profound as any health benefit I have ever known. Nothing else in medicine comes close. I'd have to agree with him because it is an amazing result of those people were on medications, they were maximally treated, all the stops were pulled out, some of them were bypass and stenting survivors and still were expected to perish within a very short period of time. And as a last-ditch Hail Mary approach, convinced them to eat plant-based diet, and they did amazingly well. So I'm honored to say I actually know Dr. Esselstyn, and he's an amazing man. He's in his mid-80s now, and still, as I met him recently, he's still traveling around doing regular talks. It's extraordinary. As I mentioned to people last week, I do suggest you go to Google or some other search engine and search for TED Talks. And this, the one we are referring to is Dr. Esselstyn's TED Talk from back in 2012, and it's called Making Heart Attacks History, Caldwell Esselstyn at TEDx Cambridge. A very important talk that I think would be beneficial for everybody at risk for heart disease, which is everybody, to watch and to hear some of his patient experiences. As I mentioned, the book he's written called Prevent and Reverse Heart Disease. The front part of the book is a description of his 18 patients and their experience, and then some pictures, and then the back part of the book is a recipe book. Dr. Esselstyn, his wife Anne, and their registered nurse daughter Jane have also recently produced a Prevent and Reverse Heart Disease cookbook. But the same principles apply here as they do in the recipes found in the Forks Over Knives website, of which there's hundreds of free recipes online. So there's lots of places where you can get healthy recipes that fit with this principle of whole food, plant-based eating, no added oil. So how Esselstyn stumbled across this idea was much the same as Campbell, was his interest in rates of cancer around the world. Esselstyn, by his training, is a surgeon. He was an army surgeon in Vietnam and later became the, I think, head of surgery and thyroid surgery at Cleveland Clinic. Fairly high status physician in that area amongst the medical staff, and was also on the breast cancer task force for the United States and through Cleveland Clinic. So he was a big wig in that very conventional area, and was, as he describes, very frustrated with the fact that he was doing breast surgery on one particular patient at a time who was really unaware, as he later found out, of her risk of developing breast cancer is so heavily weighted on her exposure to nutrition. And things that gave him a tip-off was, for example, the data on that Japan has about 2/3, Japanese women have about 2/3 the risk of breast cancer. And when Japanese women immigrate to the United States, within a generation or two, they have breast cancer rates approaching that of Caucasian women in America. And other data was data on cancer of the prostate, which he describes in his TED Talk, and saying that in the Empire of Japan, for example, the rates of prostate cancer is significantly lower, and especially in places in Okinawa. And the main differences in their culture versus our culture is a difference in nutrition. And you know, people often say, oh yes, but that proves that seafood is healthy. Well, actually, the percentage of food that the traditional Okinawan diet was of seafood or fish is much, much less than 2%. So it really wasn't a fish-heavy diet. It was a diet of rice and vegetables that had some small amounts of fish and seafood there, almost as a flavoring agent. And we know that for sure because now, in the past 30 to 40 years, Okinawa, like other parts of Japan, has been very Americanized. And sadly, we now can see that Okinawa and other parts of Japan have obesity and diabetes rates that was so previously much, much lower, and now it's approaching that in the United States. So when people eat like Americans, they get sick like Americans too. So it was this data and other population studies, the various rates, very significant differences in heart disease rates throughout the world. And when countries who ate predominantly plant-based foods or trending towards that way had much lower rates, and countries like Russia and Slavic countries who are large on meat consumption, also South America, had very high rates of cardiovascular disease. These observations, the Tarahumara Indians in Mexico who ate predominantly sweet potato, these are the Tarahumara indigenous people who are famous for their long distance running capacity. And of course the Okinawa experience, where now, sadly, we have a before and after picture that Okinawa, immediately after the Second World War, was one of the highest rates of centurions. People lived to 100 years than any other population. And now, sadly, Okinawa, I understand, have rates of obesity and diabetes and heart disease that are approaching the United States. So Uncle Sam really didn't help Japan a whole lot in terms of global health. In terms of Esselstyn's work, after he convinced people, seeing these observational studies, and then developed a diet basically to mimic what the healthiest people in the world ate, he then started following people, and in some people who required follow-up evaluations of their artery sizes, began noticing and hearing a lot of improvements in ischemic pain when people walk. For example, if you had a narrowing in the vessel leading to your leg and you walk and you get pain, it's called claudication, but it's essentially an outstripping of the blood supply because the vessel leading to that muscle area in the leg is not getting enough blood flow. And then the muscle still has the function, so it switches its metabolism to another energy source, but in doing so, it tends to produce a lot of acids. And the acid is what you feel in claudication, or if you're walking and you have a narrowing in your heart artery and somebody gets chest pressure and they stop and it gradually goes away, what the person's feeling is basically a chemical burn in the tissue of the heart, which is the reason why you feel that heaviness, that rather than a pinprick sensation, it tends to be a very heavy, deep pain that people have with angina. So what it is, it's basically a chemical burn from localized acid collection in the heart. So Esselstyn had reported a number of scenarios where small amounts of plaque improvement were seen in a number of months of some of these patients. This plaque improvement here was estimated as a 30% improvement, which again on the surface says, okay, this is what I get for eating plants. Don't seem like much a big deal, but it is a big deal when you look at the clinical effect on the patient. Reason for that is, just back to a bit of physics, is that when you have a narrowing in your artery, so you have an artery here, the issue of blood flow or lack of blood flow is how much blood flow you get to the tissue. So if you have a narrowing in an artery that's 40% narrowed, you actually, when you're at a rest position and getting a certain amount of blood flow here, and now you're increasing the demand of the tissue, so you're running or working harder, you need to increase the demand. If the blockage here is less than 70%, you actually can increase the 3 units of blood and get 3 units downstream and no harm done. What happens is when this blockage gets to more than 70% narrowed, what happens is you can get enough blood through at rest, so maybe 1 unit of blood there when you're at rest, but when you increase the demands of heart or leg muscle and there's a 70% blockage, there comes a point where you try and increase that blood flow across that stenosis, but now you might only be able to get 1.5 units of blood past that blockage. So the reason why a 30% reduction in narrowing of this man's coronary artery could easily result in him having essentially a lot of symptoms with this 75% narrowing here, going from 60% narrowing, so don't sound like much, but a significant change that he could go from severely disabled with angina here to a man with no exertional pain with carrying groceries or having sex. So again, an angiogram results that seem subtle, but could have significant consequences on that person's quality of life. But probably most important and most famous now is one of Esselstyn's own colleagues, a fellow surgeon at the Cleveland Clinic, which is described in Esselstyn's TED Talk as well as in Forks Over Knives, a documentary we suggest everybody to watch. The now famous picture of his colleague who was in his 40s, had a heart attack, had an angiogram, and was shown to have blockages at the mid part of the main artery. The main artery in the heart is known as the left anterior descending, or the LAD. A severe set of blockages that started at the mid and extended distally, so that back in '96 they did not have the stenting technology to open up that artery successfully. And when surgeons looked at the artery, when a bypass surgeon is looking at your arteries, and you'll hear cases where so-and-so was turned down for surgery. One of the reasons for that is for technical reasons, because they actually need, you can have a diseased area here, as long as distally this segment looks like this, it's big and plump, to tie a bypass graft to, you may be a candidate for bypass surgery. But the surgeons felt that this segment here was so small and also diseased that they didn't have a healthy segment to tie the bypass graft to. So he was sent home on medications and felt pretty kind of depressed, thinking that, well, modern medicine can't offer me anything other than medications, and so what am I going to do? So Esselstyn at that point had been in the heart reversal, cardiac disease reversal business for nearly 10 years, and he suggested to his colleague that, what do you got to lose? You got the standard American diet and you got the standard American disease, so why don't you come plant-based? And lo and behold, this physician decided to say, well, I got nothing to lose, let me try eating better. And when he did, he actually had a follow-up angiogram. I think it was for insurance purposes for people who worked at the Cleveland Clinic there, because these are pretty valuable people, surgeons to have on staff in a big private hospital, so they need confirmation that their disease is improving. I think that was the reason it was done, because we don't routinely do follow-up angiograms because they're not without risk, they're invasive. But we have now the benefits of time that about 30 months later or so, uninstrumented artery completely opened up in this man and showed tremendous results. And all he did was switch his nutrition. His medications didn't change. There was no stenting. He had no surgical procedures. So it is an amazing case of very significant improvement on angiogram. Now, just as important, Esselstyn again saw significant reductions in event rates, which in my opinion is even more important than what your angiogram looks like, because you can keep your shirt on and nobody's got an x-ray machine around. We don't know what your you might have a very ugly looking angiogram, but you look good in a suit. So the most important thing is what your event rates are. And as I'll discuss later, Esselstyn was able to take a study that he later did with nearly 200 patients and significantly drop event rates. And I mean significantly, by about a factor of 50 compared to people treated for heart disease with just medications alone. I'll come to that in a moment. One of the important areas where all of this disease occurs is, this doesn't project very well, but is a very thin single cell layer of cells that lines inside all of our arteries. The arteries are the high pressure vessels that come from the heart, not the veins. These are the arteries, and this lining of cell is called the endothelial layer. So the endothelial layer is here, and it's just a single layer of cells, and it's an extremely important layer of cells because it's the area where bad things happen in terms of forming plaques. So oxidized cholesterol and high-risk, high-fat foods tends to cause this cholesterol to basically bury itself in under this endothelial layer. And as it buries itself, it causes this bulging out of the endothelial layer. And that bulging out is known as plaque or narrowings. There's lots of $10 words: atherosclerotic plaque, hardening of the arteries, blockages, all the same word and language for plaques, and that's what does two major things. One is, in the long term, it causes restriction to blood flow, and if you outstrip your blood flow, you'll get pain or some sign of lack of blood flow. But the other issue, as we'll talk about now, is the more dangerous thing what happens. As I remember hearing some kind of a drug talk by a drug company representative, one of their slogans, because the drug company representatives have tremendous teams of people to come up with amazing catchy slogans, and one catchy slogan that I think applies here is, I remember seeing a drug company profile do it, saying that it's the clot that kills. And I think it's a good line, because you see these plaques that I told you are formed from poor diets, especially animal-based foods and plaques. The complexity of this is fairly complex, why these things form, but they form a whole lot more often in people who eat a high-fat diet and in people who eat an animal-based diet, which is basically, by definition, is a high-fat diet. So what happens is these plaques form, and even the ones that are not narrowed more than 70% to restrict blood flow, but that are a stable situation, if they actually, over time, continued poor eating habits and high-risk behaviors in eating and so forth, stress may also play a role. Over time, the inside core of this inflammatory glob actually eats away at the very white layer of the cap. So this is the cap we talk about, the cap over the plaque. It's a lining of endothelial cells that's bulged out into the lumen where the blood flows. And what happens is this eats away gradually until this lining becomes super thin as a cobweb, like Dr. Esselstyn says it. And then when it begins to rupture. And now the contents inside that plaque, which tend to be gooey and liquid, semi-liquid, spurt out into the flowing blood and cause the blood to clot. So now you go from blood flowing adequately 1 minute, and if it's a 30% blockage, that person would not have likely had chest pain when they walked up a hill, for example, to rupturing the plaque, completely blocking the artery, and then all the downstream muscle is at threat of lack of oxygen, forms, it temporarily has one of two options. Downstream, the heart muscle, 3 out of 4 people, their heart muscle switch the food source and metabolize another food source but produce acid, and that's why people grab their chest once they rupture a plaque. But 1 out of 4, the heart muscle's response is a sudden abnormal rhythm, which is called ventricular fibrillation, which basically means the heart pumps one moment when it goes into or ventricular fibrillation, the heart just stops effective pumping. And that's the reason why some people's symptoms of first heart attack or their first symptom of a heart attack is just sudden death. So it makes heart disease all that more scary. And one of the comedic slides that Esselstyn shows is oil is really important here, and that oil should be considered a toxic food when taken as an oil itself. So oil, when it seems to be mixed amongst plant-based foods, and all plant-based foods have small amounts of oil, some of them have more. But when you take a food like a plant-based, unprocessed food and eat it, even like potatoes or bananas or rice or corn, you know about corn oil, so oil is contained in corn. But when you eat it as the whole food, be it corn or potatoes or even rice has small amounts of oil, that oil, when it's suspended amongst the package that it was created in, doesn't seem to be toxic. And yet when you take those products, be they plant-based products or animal-based products, and squeeze them out, squeeze the oil out of it, and then pour that oil back on your food, when you consume that oil, it tends to be highly toxic and cause vascular problems, which we'll talk about. So the amazing thing that Esselstyn showed, which I'm always emphasizing to patients, is that whenever we prescribe a drug to get an improved outcome, we always got to look at, okay, how many people are we going to harm versus how many people are we going to help? In the nutrition area, the reason why this is so exciting as a cardiologist like myself is that there's no pay for it. We don't have to pay any risk. You know, as long as you don't choke on a piece of celery, there's literally no risk of eating plant-based foods. You could just as easily choke on a chicken bone, by the way, so eating could be dangerous. You got to be careful. So there's no downside to basically eating plant-based foods, which makes it extremely exciting, because his later study, as I alluded to earlier, 200 patients having survived a heart attack, having come through stenting and bypass surgery, Esselstyn then offered them to learn about plant-based nutrition and then followed them for 4 years to see, number one, how many people are going to stick to his eating program. Well, he had a 91% compliance rate, so 4 out of 5, more than 4 out of 5 people stuck to it, so it is doable. And then more importantly, what was the event rates amongst those people who actually changed their diet? And the event rates were compared to what that would be expected of other people who they survived heart attack or stenting or bypass surgery. You put them on meds, you don't talk about nutrition too much, which is the usual scenario, and you send them home. 4 years later, about 1 in 4 of those people will be expected to have another cardiac event, which is a pretty high failure rate. In Esselstyn's patients, the 91% who complied with his eating program, their recurrent event rates at 4 years was less than 1%, 0.6%. So from a statistical, real-life medical model, that's about as good as you can do to humanly protect somebody from having recurrent cardiac events. Hence the phrase you'll often hear with Esselstyn, he made people heart attack proof. Those people now, again, were on medications, but they were on medications plus optimal nutrition. This is the paper published in the Journal of Family Practice. I think this was in July 2014. And it was entitled A Way to Reverse Coronary Artery Disease. If you're interested in getting this paper, you should be able to find it as a PDF on Google. If you can't, just email the clinic, drshanewilliams@mac.com, and we'll send you out a copy. I think I'm getting close now to my time, so I wanted to know and see if there's anything happening online there. Okay. So if you want to ask some questions or have some comments there, I think that would be useful. Related to Esselstyn's most recent paper about this oil issue, because the oil issue always tends to come up. And I confess to you, first when I got into plant-based nutrition and started telling this to patients, a lot of people were saying, what is it about this oil thing? Is oil really that important? If I switch to away from an animal-based diet with heart disease, will I still get benefit if I continue to use oil? My quick answer is yes, you'll get benefit, but the optimal benefit really seems for you to pay attention to processed oils, isolated oils that you pour on your food. So this idea that olive oil makes the Mediterranean diet healthy, no. The Mediterranean diet, when you look at the overall nutrition from the Mediterranean diet, it has way more fruits and vegetables than an American diet, just about any diet does. And so the 15% reduction in event rates as obtained from the Mediterranean diet is likely not due to the olive oil, but it's there in spite of the olive oil. So if you took a Mediterranean diet and took out the fish and the skinned chicken and the added oil, you basically then have the Esselstyn diet, which in the study that he did showed a more than 90 to 95% reduction in event rates. So oil poured on your salad is a real shame, because all the benefits of salads and greens and all of that healthy stuff is actually at least negated and maybe kind of totally dismissed when you add free oil back on the food. So we strongly suggest you take a look at, there was an editorial done by Esselstyn recently, this was I think the end of 2019, called, in the editorial, "Is Oil Healthy?" by Caldwell Esselstyn. And again, if you want to copy this, you should be able to find this online at Dr. Esselstyn's website in a PDF form for you to go in and have a look. I'd suggest you go have a look. In terms of the case studies here that we've experienced, we've had tremendous response to people who switched from an animal to a plant-based diet with heart disease. Most of them have significant improvements in angina, weight reduction, reduction in blood pressure, improvement in diabetes, some cases reversal, which again allows people who have heart disease and may require some medication or a bunch of medications forever for the rest of their lives, take them from 8 or 10 medications down to 3 medications. And that's a really big improvement, because as an ex-pharmacist, I know that sometimes there are roles for medications. If you've had a heart attack, I think everybody should always be on low-dose aspirin. The risk reduction of aspirin after a heart attack is about 25% of your risk. So it's a significant risk reduction. Is aspirin harmless? No. Aspirin causes the excessive bleeding of thousands of people every year. But the problem is, if you take the aspirin away, it's going to cause an excess of many more thousands of heart attacks and premature death. So hence, back to the issue like I mentioned before, whenever we use a medication, which is the appeal of nutrition, whenever we use a medication, we're always looking at risk versus benefit. And there's always a risk with every medication, even when there's a net gain and an overall benefit. There will be a certain number of people who are injured. As opposed to, that's why you want to get as good as you can. You want to get whatever benefits you can from an intervention like optimal nutrition, which has essentially no side effects, no downside, assuming you're not allergic to one of the foods, which could happen in any particular case. So do as good as you can with your nutrition, and then only as a last resort, stay on the medications if they clearly provide you a benefit. And if you approach it that way, we've been able to safely get many people, as I mentioned, from 8 medications down to 3 medications, usually in much lower dosages. And the dosage factor is important too, because the risk of side effects for most chemicals is related to the dose. So your risk of having an adverse reaction from 80 milligrams of Lipitor is way, way higher than being on 10 milligrams of Lipitor, for example. And so if you can eat well, get your cholesterol numbers very, very low, and only require a small amount of a cholesterol medication, that's a much preferable place to be than, say, damn the torpedoes, eat whatever you want, maximal dose of statins, which now you're going to harm yourself from the poor diet, plus your cholesterol levels are going to be out of target despite being on mega doses of statins. And being on that mega dose of statins, as many as, in the case of 80 milligrams of Lipitor, as many as 1 out of 3 people can't tolerate that dose because they get too many muscle pains or joint cramps or muscle cramps and joint pains or whatever. So definitely the basis of all your optimal management of heart disease should be to maximally improve your diet as much as possible and only use medications as a last resort when they clearly show benefit, and again in the smallest dosages possible. Yeah. What about coconut oil? Is my Sidian assistant here who tells me. So coconut oil, again, seems to be something that's been extremely well marketed and seems to have all the same deleterious effects of any other free oil. So whenever you basically take, again, a plant or an animal and remove the oil from it and leave it just as an oil, as I think Dr. John McDougall uses the expression that at best it's a medicine, and not a medicine in a good way, and at worst is highly toxic to vasculature. So coconut oil seems to be, although the trend is coming down now recently, seems to be the most heavily marketed version of oil, and it doesn't seem to have any protective effects compared to any other oil out there. Olive oil, you know, cornered the market for many, many years. Again, basically coming on this whole tail end of the Mediterranean diet craze, where you do need to look at the details of it. Again, if you took the Mediterranean diet and took out the olive oil, it would be much, much healthier. And so it's not healthy because of olive oil. It's healthier than an American diet despite of the olive oil there. So coconut oil, avocado oil, safflower oil, corn oil. So the oils, even from healthy foods like corn, better to eat the corn. Almost like people say, oh, should I take vitamin C? No, eat the orange. Like, stick to the actual foods in which these things naturally occur. First of all, the chemistry is extremely complicated. On the issue of vitamin C, for example, the vitamin C that's sold in labs and sold in bottles in pharmacies, first of all, there's a lot of controversy about whether or not the vitamin C reported is actually that vitamin C. The other issue is that reducing it just to one chemical of vitamin C is the likely benefit of things like oranges and citrus fruits come not just from the vitamin C, because when they do the gas chromatography analysis, they actually find a whole band of hundreds of different vitamin C-like compounds found naturally in fruits and vegetables. So the chemistry of nutrition and the chemistry of fruits and vegetables is extremely complicated, which makes sense then when you isolate one of those chemicals, put it into a tablet, and sell it in the population. You don't see measurable, clinically proven benefits because you've reduced it all, and you may have even taken the wrong chemical that does the benefit. Or maybe the benefit of the oranges doesn't come just from vitamin C, but may come from vitamin C plus the other chemicals which are similar to vitamin C acting in conjunction to one another. So the chemistry of food and digestion is extremely complicated. And one of the reasons we're likely into this problem of reducing everything to take that pill, take this pill, is in order to, for drug companies and the business of medicine to protect their intellectual property and to own a molecule, they got to reduce it to one molecule. But the human body doesn't work that way. The human body has billions of chemical reactions going on at all times, and many of these hundreds of different reactions and chemicals interacting all at one time. So I like Colin Campbell's, and I don't think this is overly hippie expression, is that literally the chemistry of digestion is less like a mechanical, chemical reaction 1 leads to chemical reaction 2 leads to chemical reaction 3. It's more like a symphony of chemical reactions because it is actually so complicated. And you only realize how complicated something is, what we seem to think is simple as absorption and digestion is, until it goes wrong. If you have any friends with inflammatory bowel disease or some thickening of their lining of their bowel, you just notice how sick they become and how unwell they become. So chewing food, absorbing food, nutrition, and all the chemicals contained in that chemistry is extremely complicated. So best for us to stick with things that are simple, avoid animal foods, and if you're going to eat them in very small amounts. Avoid processed foods and things that basically have no nutrition in them, and stick to the whole foods. And where possible, and especially those with vascular disease and diabetes, focus on a no added oil, whole food, plant-based diet. And that'll both prevent you from getting heart disease and optimally treat you in case you do. All right. Well, that is my wrap up. If people want to have sort of an extra bit of information that's recently released in December, I would suggest you look up a trial called the ischemiatrial.org. It takes another aspect of this heart disease treatment and has a very sobering result. And I suggest you guys go in and have a look at it. There's lots of slides online explaining what they did. In a nutshell, they took people with very severe blockages. Because up to now, the way cardiology functions and still functions, unfortunately, is that when people have very abnormal stress testing results and they have angiograms and are found to have 3 vessels blocked, it's been our mantra and practice patterns always to say, okay, you can eat better or not eat better, or you can be on meds or not, but for heaven's sakes, those people need to have those arteries opened with stents or bypass surgery. So that was a very important question to answer is, hold on now, that's how we practice. But has anybody ever taken a really, really critical look and measured those people who were bypassed versus those people who were left just for medical therapy. And how are they going to do? Well, much to cardiology's frustration, I'm sure, and people who deliver stents and bypass surgery, they took 5,000 patients. Half of them, about 2,500, went to invasive treatment, and the other half were kept on medications alone. And 5 years later, the people's statements were assessed, positions and progress was assessed, and essentially there was no difference in rates of heart attack, early death, stroke, no difference in event rates, which is a very sobering finding because, of course, these surgical procedures are quite invasive, and we've always been doing them for years, thinking that surely heavens that there's a 2 to 5% chance of killing someone on the table by having a procedure, so a 5% mortality. And we're doing it, we hope, with a view that down the road that protects those people, because surely all those blockages are an ischemic milieu and creates all kinds of lack of blood flow. And we want people protected, so we're doing it for your greater good. We're putting you through a very invasive power saw to the chest sternotomy and doing this procedure for the greater good for you. And this trial result is a very sobering result to say that, wow, maybe more invasive, highly technical procedures are not of any more benefit than medicines alone. And now with the data around plant-based nutrition showing that it can significantly improve symptoms, that all the more reason that people should more than ever focus on eating a whole food plant-based diet. And if you have heart disease, take medicines, but take them in the smallest amounts, the lowest dosages possible. And that would be making a case for the optimal management of most heart disease patients is don't forget the food. The food is critical, is just as important or statistically more important than the medications you take, although medications have a role in established heart disease as well. But don't ignore one side of the bird here in terms of the both wings. One is optimal medical therapy, but the other side of the bird to fly properly and to get optimal health really is lifestyle management. Don't ignore your nutrition, because if you do so, you're missing out on a large area of being able to protect yourself and really make yourself heart attack proof, which is a phrase I hesitate to use because we don't want to prove that we've cured any heart disease, but if we can get your event rates at 5 years after you've survived bypass surgery or stenting down to less than 1%, we know then from a doctor's point of view, medicine and nutrition, we've maximally protected you to increase your chances of being able to get old and to live a good life. So with that, I'm going to sign off, and thanks for everybody tuning in, and I hope you're safe and you have a good day.